Many have argued that the patient had lied against our own brother, and a lot of people also argued that many patients, especially in this part of the world, where some do not even like you for the fact that you are a person of color, that they could lie and lie in order to have you put behind just for the fact that they don't like you. In this very case, it was an incident involving a 47-year-old Nigerian man, Mr. Adewale, who was accused by a patient he was looking after in the hospital. This incident happened in York. York is somewhere close by me here. Our brother was working as a healthcare assistant. He's a family man. The woman is also a married woman who was at that point very much vulnerable and immobile. She could not walk at that moment, and our brother was assigned to support her by giving her what is called bed bath. And at the process of doing that, our brother, I don't know, he claimed he acted out of sympathy. Maybe I should read the lines, but I would like to hear your opinion at the end of this. According to the York News, our own brother Adewale, 47-year-old, assaulted a woman when she was particularly vulnerable, owing to a serious health condition which made her ineffectively immobile. Like I stated earlier. What happened? A married family man, which is our brother, kissed a patient on the lips while she was lying in bed and barely able to move due to her condition. Kissed a patient in bed. And why did he do that? We need to find out the reason behind his actions. Because in my own country, Nigeria, if I'm supporting a patient as a nurse or a doctor, I do not think that it is acceptable for me to kiss any patient, be it a kid, an adult, here, even on the forehead. Hence, the patient is not family related. Why would I have to kiss a stranger on the head, on the face? You can speak to the person, but going to the extent of miam, 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 no, and even here, that is not necessary. That's not your grandma. So, the prosecutor, that's a lawyer, stated that our brother Adewale kissed the woman after giving her a bed bath. She tried to pull her head away to avoid the assault, but to no avail. But then, I'm thinking, why would they assign a male healthcare assistant to go give a woman, a vulnerable woman, a bed bath? Especially if this woman is very much sane, like me. Maybe I am vulnerable at the hospital in the sense that I cannot walk to the bathroom to take my bath. I wouldn't say yes to a man coming to, support me to the extent of giving me a bed bath. You know what that means? Clean and blah, blah, blah. Wipe all them corner, Bermuda Triangle zone. Man, I don't need a man to help. I would request for a woman. Yes, it is not easy. I was at the hospital sometime in September, and there was this examination a gynae was going to do on me, a male gynae for that matter. Speculum examination. You know what? If you are a woman, you've given birth, they must have used this speculum on you. You would lie down, and then they will open it. I don't know what they are looking for. They will even bring torch to find their head in between your triangles. So when the man was about, I said no. I was just restraining myself. And it was just the gynae, the male gynae, and myself in that is it room or whatever, examination room. I said no. He went out and called a nurse who was on duty that particular night to come. So the nurse was there as a chaperone watching. Then I became more relaxed because a female nurse had come in. They spoke to me. The female nurse was just pressing my fingers and all of that so that I could feel more relaxed for the examination to be carried out. So sometimes women are not just comfortable having men doing all them stuff. So why would the hospital assign a male to even bed bath a woman who is possibly sane? Yes, she is sane for her to have reported this incident, because someone who is totally not sane wouldn't report this incident, though it is still an assault and it is unacceptable. Now, on the second occasion, this incident didn't happen once. A few days later, the victim, that's the patient, refused Adewale's offer of bed bath. That is to say that she is somebody with her full senses. Yes, everybody would. Maybe the first happened by accident, but this second time, she said, no, you're not going to give me that bed bath, But guess what happened? Oh my goodness. She refused, and this our brother bent down and kissed this woman on the forehead against her own wish. This was just beyond it. He was particularly looking for something. A married man, a married woman, a vulnerable patient at the hospital who in any way does not relate to you. And guess what? This very incident was said to have occurred when this patient was in a lot of pain and was not able to move. Maybe she was, she couldn't just report this. She was waiting for her to recover fully before she could take the step. Suddenly, our brother, Mr. Adewale, had just been living in the UK for just 9 months, less than 1 year. He arrived in the UK, and this happened. This woman plan to come do for work for this country. Even in Nigeria, this is not allowed. I am certain about it. No stranger would come and kiss me in a hospital bed in my own country, Nigeria. Talk more of in a foreign country. The patient, probably after she recovered, was the one that reported this incident to your police. And our brother, Mr. Adewale, was brought in for questioning. Guess what he claimed? He told officers that what he had done was in keeping with his job. And he said he had kissed the woman on the forehead, not the lips. Please, all the healthcare workers, healthcare assistants, domiciliary carers and all of that, 1 to 1, 3 to 4, is there any particular guidelines that suggest that you can kiss your clients, your patients, just on the forehead, especially these people, on the forehead, I don't think it's wise. Even though that most of them, they do it to their own here at work. Yes, I've seen Oyibo people, at work, especially here. But you now, have you forgotten where you are coming from, the distance? I mean, they are not that free with you. These are not just your people. You should tread with caution, And he continued to say he had acted out of sympathy for the woman and the condition she was in. My brother, not be like that. Even your wife at home, how many times have you kissed her on the forehead, even as you are leaving the house? Not be like that, So moreover, in a statement read out by the prosecution, the victim said she had been living with feelings of helplessness, fear, and loss of trust in people. She had suffered anxiety attacks, depression, flashback to the incidents. The trauma continues to impact on her daily life. You can imagine. So she kept reflecting on what played out. Here is the punishment for our dearest brother, Mr. Adewale. He was handed over a 12-month jail sentence, but was told he could serve only half of the month before being released. Now, what is the implication of this? Having been given a 12-month sentence, reduced to 6 months, and definitely he would go in for that 6 months to serve, it would be very much difficult for this man after he had come out to find a job. I know that a lot of patients used to lie against care workers at times. It has happened in my workplace. I think I've shared that in the past. Yes. Not really the patient that lied in my workplace. It was another carer who lied against our own color, hitting a patient, whereas that never happened because that patient was also vulnerable. It was just playing thingy, tapping a patient on the forehead here. Then the carer stated that our brother hit the patient, slapped. How can anybody? And there were just 3 of them there. If our brother wanted to assault a patient, it wouldn't be before his own colleague. Are you getting me? So nobody believed that that incident died down. But coming to the comment section or various workplaces, a lot of carers, they have complained that most often these people lie against them. Some would even tell you in their in your own face that they don't want you to support. I've been told years back, a patient had told me that she doesn't want my support. That's racism, you know. And then I said, thank God, though, enjoy yourself. It was even in a care home, you know. But what am I saying here in a sense? If you are a carer in this foreign country, draw a boundary. Know your limit. It is not in your place to start kissing anybody, any patient, hugging, even touch. Me that I work in schools, you don't have any business touching a child. Even when a child falls, you can support the child to come. But just that's why it is also important for you to know the names of people you are dealing with. Address them by their names. Call the person out. I think that's okay, you know. And in a situation like this, whereby you are supporting a woman, a man supporting a woman, and you might be having to do something that would involve hands-on care, where you do personal care and all of that, please ask for the presence of another female carer to be there as a witness in case the patient comes up with a story tomorrow. Don't just go in and do it alone. No. In the other way around, this Mr. Adewale must have done this, you know, in order to sympathize like the woman, like he claimed. He didn't deny that he did not kiss her on the forehead. He may have done that with a good intention. But guess what? Assuming Adewale was a woman, this patient may not have, you know, taken any offense. And he did it for the first time, second time, 2 different occasions, you know. So the woman feeling unacceptable or weird about this is something that shouldn't be disputed, you know. Maybe he didn't mean to harass that woman, but avoid contacts. I mean, especially the contact that somebody would suggest that you try. It's just like even mistakenly touching someone's bum or here, you know, it can be seen as an assault. That's why once you do that by mistake, even women to men, they do say sorry, you know, I didn't mean to. Oh, sorry, you know. Talk more of a man. They might see it in the other way around and claim that you meant that. I don't know. It is not in your place to go on kissing a patient, opposite sex, forehead. Now, I am a black lady. If I was in a hospital, a male nurse, whatever healthcare personnel, you know, coming to kiss me at the forehead, definitely I wouldn't allow that. Whether no Yibo, I've been a black, I've been a yellow, I wouldn't allow. It's not in your place to do that. You're not my husband, you're not my child, you know, you're not my family. So it is unacceptable. Even a woman may not even want to do that to a female patient. Talk more of, you know. Alright guys, this is it for this content. When things like this happen, it is good to talk about it so that others in that same field would learn and avoid such, you know, incidences happening to them directly. Yes, because it will be very much difficult for our brother to take up a care work in healthcare setting, children, any vulnerable individuals in this very country. No way. His DBS is currently affected. So guys, this is it. Like my video, subscribe to my channel, and keep coming back for more. Bye.